Dr. Sanford Block, our forensic dentist in the Office of the Medical Examiner of Cook County, examined the body. One of the things he found was that there was one tooth missing. This was the left upper central incisor. That's right up in the front of your mouth. This is important because there were a number of rumors about the condition of the body, and one of the rumors was that all of his teeth had been knocked out. Well, this tooth had been traumatically avulsed. There was a fracture in the upper jaw, and when we opened the mouth at the autopsy, we found the tooth that had been knocked out. It was still in his mouth. Have you ever heard the expression, "Don't look a gift horse in the mouth"? Well, the reason people will look into a horse's mouth when you're buying a horse is to see how old the horse is. And with young people, you can do similar things. And it comes down to, at this age, it comes down to the eruption of the second molars and the third molars. You know, it's funny, these teeth have names. You know, your third molars are called your wisdom teeth, meaning by the time they come in, you're supposed to have a little wisdom. The second molars, strangely enough, are called your work teeth. And this goes back to the Industrial Revolution in England. And before a child could go to work in a factory, he had to show that his second molars had erupted and that he was 14. This is how they would establish it, so that this was a protection against child labor exploitation. Well, here we see that from the x-rays that the third molars are up higher, right here, and down lower on the lower jaw, that the third molars were unerupted. The second molars are completely erupted. So that puts it roughly between 12 and 16 years, approximately. The next thing Dr. Block did is those second molars, the work teeth, he looked at the root formation, and he found out that when he looked at the root formation, you can see the arrows, the root formation was incomplete, and the root formation on the second molars becomes complete at about 15 years. I believe this is work that was done by Douglas Ubelaker. So that they're not complete, so they're on the low side of our age estimate. Another thing, Emmett Till had a very distinctive gap between his left lateral incisor and his canine tooth. The canine tooth is your eye tooth. That's the long, sharp ones. When you watch all these vampire movies, those are the ones that grow when the vampire is becoming aroused. Well, between the lateral incisor and the canine tooth, there was an angle of approximately 70 degrees. When we checked against the body, there was also an angle of approximately 70 degrees. Dr. Block decided that the deceased age lay in the range of 13.5 to 15.5 years and was consistent with the age of Emmett Till of 14 years and 1 month at the time of his death. Dr. Ubelaker examined the body, and he felt that the dental formation, the bone development, the growth plate union were consistent with the known age of Emmett Till, and that the skull exhibited extensive fractures of the cranial cavity and base without evidence of healing and were not produced during exhumation. Now, there was one piece of new technology that we were able to utilize, and that's called mitochondrial DNA. And without getting into a lot of cell biology, I think we're going to have to tell you that a biologic cell has two parts. The central part, called the nucleus, and the surrounding portion called the cytoplasm. Now, the DNA, the deoxyribonucleic acid in the nucleus determines things like the color of your eyes, the height, and even your sex. And you get nuclear DNA comes from both parents, so it's a mixture of DNA. Strangely enough, in the cytoplasm, there is DNA, and it's contained in the mitochondria, which are kind of the energy powerhouse of the cell. They supply the energy to the cell. And these DNA come from the mothers. And in fact, the mitochondrial DNA in the sperm is contained in the tail, and at the time of conception, that mitochondrial DNA is destroyed. Now here's a truncated family tree for Lula Tolliver, who was Emmett Till's great-grandmother. And you can see that Simon Wright and Emmett Till are related. They would be first cousins once removed. And we would predict that Emmett Till and Simeon Wright would have the same mitochondrial DNA because they're related through the maternal line. Well, we took the DNA samples from muscles from the unknown body alleged to be Emmett Till, and we took a blood sample from Simeon Wright, and the DNA sequences were identical, which is exactly what we would expect. So they have a strange way of phrasing it, though. What they said is the body cannot be excluded as a maternal relative of Simeon Wright. So what it means is probably a relative of Simeon Wright. This was a surprise. We found 4 lead fragments were recovered during the autopsy, and they were, we sent those to the FBI lab, and they were lead shot pellets consistent with number 7 or number 8 birdshot. And there were also metallic deposits on the surface of the skull which were found to contain lead residue. During all the investigations, they were talking about a handgun, a 45 automatic, and we're going to tie that together at the end, I hope. Now, these are x-rays that were taken before the autopsy, and we had the radiologist come over and review them with us before we performed the autopsy, which I think is excellent forensic technique. And you see at the top of the head, there were multiple skull fractures, and the skull was actually depressed. And there was actually a portion of bone missing. There was a large portion of bone missing, and in some of the testimony, the funeral director removed the body, said a large portion of the skull fell out when they were retrieving the body. There were also multiple fractures of the base of the skull. There was a fracture here at the angle of the right jaw. This is a frontal view of the skull, and you can see there's safety pins in there. The safety pins were due to the preparation of the body by the funeral director. But again, you see the multiple depressed skull fractures, and we've circled the lead shot pellets. Nice thing about lead, it shows up very well on x-rays because it's very dense. This again is the lateral view with the shot pellets circled. This is a x-ray of the left leg and thigh, and it shows a fracture of the large bone of the thigh just above the knee. Now, this is a diagram of the front and back of the body. The family has asked that we not show any of the autopsy photos. But these are the kind of diagrams we routinely prepare in the course of an autopsy. And the first thing we noted that the entire body was mummified. This is the dry decomposition, and there was embalming compound over the anterior and posterior surfaces. Embalming compound is a combination of chemicals used to harden and preserve the body, and it's used in cases where you can't do arterial injection with chemicals. The face was dark brown and leathery, the cheeks were wrinkled, the mouth had been sutured shut. Oh, you remember when we showed you the picture of the jaw, and there was a crescent-shaped incision under that? At the time the body was taken out of the Tallahatchie River, the tongue was protruding from the mouth. I believe that what the funeral director did is he made an incision there, took out the muscles at the base of the tongue, and then allowed the tongue to be put back into the mouth, and the tongue was there at the autopsy. That left upper central incisor, we told you, was absent. It was in the mouth. you see those circles in the abdominal cavity? Those are trocar perforations. Those are normally done in preparing an embalmed body. They stick a hollow tube and inject chemicals into the abdominal cavity. What the situation would have been, the body would have been very bloated because these bacteria that do the decomposition, they form gas. You would stick the trocar in, it would let out the gas, you'd also instill the chemicals in there that would retard decomposition. But there was something that was done. Oh, the genitalia were there and it was male. There were rumors that Emmett Till had been castrated. That was not true. The left knee, ankle, and foot were externally rotated, and that's probably due to the fracture of the femur. Now, you see there were numerous incisions over the front and back and even on the face of the body. And these are venting incisions because the body was distended with gas. The funeral directors made these incisions very large on the back and left them opened to vent the gas and reduce the gas from the body. And you see, they were very challenged about how they were going to present a decomposed body for a public viewing. And I think they did an amazing job. And from reading the Mrs. Till's description, they did it in about a period of 2 hours. They were able to prepare this body. This is a diagram of the front of the face. There was a large laceration or tear on the forehead. The left eyelid had been sutured shut. There was a tear over the bridge of the nose and the right side of the nose. And under there, the nasal cartilage was fractured. There was abrasion or scraping of the left upper and lower eyelids, and both desiccated eyes. Desiccated means, desiccation is like when you would dry something out and it becomes very small and shrunken, were present in the eye sockets. On the right side of the head, there were 3 areas of discoloration. Over the top of the head, there was a laceration that extended to the other side of the body, and this had been sutured. There were 2 other lacerations, and there was a venting incision on the right side of the face. On the left side of the head, there was a very large laceration or tear of the skin. In fact, it measured 5.7 by 1.5 inches, and fragments of skull were protruding through this laceration. And the upper third of the left ear was missing. Again, we could see the laceration that went over the top of the head to the other side, and there was an additional laceration on the left side of the head. On the back of the head, there was a tear of the skin. There were actually 2 tears of the skin. And then on the posterior neck, there was a patterned abrasion or scrape, a scraping away of the top layer of the skin. And this is probably consistent with the barbed wire that was used to tie the gin fan around the neck of Emmett Till. Now, I have here a very graphic image, and I want to warn you, it shows the extensive, what it is it's a computerized reconstruction of the entire skull of Emmett Till, and it can rotate 360 degrees. I want to warn you, it's a very graphic image. It's as graphic as the images that Mamie Till showed at the wake because of the extensive destruction of the skull of Emmett Till. So I want to advise you that if you're squeamish about these things, please do not look at it. But before we start, I just want to point out a few things that are visible here. That left upper central incisor is missing. And then there is, on the right side of the nose, you see that space there? That's the fracture of the nasal cartilage. And also the fracture at the left jaw at the angle of, the right jaw is visible. Now we're gonna start this. It's going to rotate completely around. I can't stop it once it starts rotating, so you're gonna see the whole thing. See the safety pin from the funeral director? I'll show you that again if you'd like. Now, this is technology that also would not have been available in 1955, and this was done for us at John Stroger Jr. Hospital. Well, that concludes my remarks about the examination of Emmett Till, and I want to thank you for being such an attentive audience.